Our next guest is the Surgeon General of the United States, as well as a member of the White House's coronavirus task force. We are honored to have Dr. Jerome Adams joining us now. Doctor, thank you so much for joining us. Know how busy a time this is for you right now. Now, as you know, first responders are on everyone's minds right now. What are you saying to those you're talking to one-on-one in a private conversation when they express concerns or fears?
Well, Dan, it's great to be here. First of all, many people don't know the Surgeon General is the operational head of the Public Health Service Commission Corps, one of 7 uniformed services, 8 if you count the newly formed Space Force. So we feel a deep kinship with uniformed officers, with our first responders. And I love your show. I lived right down the street from Lawrence, Indiana, where you filmed, and have been to Jeffersonville and Clark County when I ran the State Department of Health there. So I talk to the law enforcement officers all the time, and here's what I tell them. It's important to know that, number one, the most important thing you can do is maintain social distancing. And that's hard to do for first responders. It's something we have to intentionally think about, but try to avoid getting too close to people, 6 feet or 2 arms lengths, if you can. Also, make sure you're always washing your hands and staying clean. Hygiene is critically important, because we know that coronavirus can spread by droplets, and when it can get on your hands, or if it's on surfaces, you can then touch your face and contaminate yourself. And then finally, don't touch your face if your hands haven't been cleaned recently.
Well, let me ask you about that, because there's also a new report that says that you can actually contract the virus in the air from just breathing. You know, that's obviously going to be a concern for those first responders on the front line. How do they deal with that new information?
Well, great question. And I've talked with Dr. Fauci, who I consider the top virologist in the world, and he assures me that the primary means of transmission is still droplet, which means 6 feet. This is not a disease like measles, where if someone's on the other side of the room breathing, you're going to get it. So when you hear people talk about aerosol transmission, those are experiments. Those are not natural conditions. Again, if you stay 6 feet away from someone, that is your best protection. You may have also heard that we recommend, particularly in areas of high community spread, that people consider wearing masks, not to protect themselves, but to protect other people in the event that they are an asymptomatic or pre-symptomatic carrier of COVID-19. But again, from law enforcement's perspective and first responders, sometimes it's hard for you to maintain that distance. So just make sure you're not directly in the line of fire, if you will, when someone is talking or coughing or sneezing. Make sure you wash your hands. Make sure you clean your belt and your equipment after a close encounter with someone else.
Well, you mentioned the face masks, and the CDC now recommending that Americans wear them when out in public. Are you wearing one when you're out in public? And is it going to be a tough sell, do you think, to the public at large to say every time you go out you should wear a face mask?
Well, Dan, that's a great question, too. And it's important for people to know that originally the CDC, the World Health Organization, and my office, as well as most public health professional groups, recommended against the public wearing face masks because the best available science said they didn't protect you from contracting coronavirus. So here's what's changed. We've learned that, again, many people, about a quarter of people who transmit COVID, are transmitting it before they get symptoms or pre-symptomatic. And so we now recommend that people consider wearing a face mask to protect other people from you. And so that's especially if you are going to be within 6 feet of someone else in a grocery store, in a pharmacy. And so to answer your question, if I'm going to the grocery store, I'm going to wear a mask because I want to protect other people. My mask protects you, Dan, and you wearing a mask protects me. And so what I would say to the public is, just as we tell people to stay at home, make sure you're doing all you can to protect your community. If you wear a mask, wash your hands before you put it on so you don't contaminate your face. Don't touch your face. Save the N95s and the medical masks for the healthcare workers and frontline workers, because they need them, because they're taking care of people who are COVID positive. You can get away with what we call a cloth facial covering. And remember, this isn't a substitute for social distancing. It doesn't mean you can go out and shoot hoops with your buddies if you wear a mask. Still, we want people to maintain that 6 feet of distance.
The White House announced yesterday that anyone meeting with the president or the vice president will be getting a rapid COVID-19 test to prevent them from becoming infected with the virus. When do you think a rapid test like that might be available for first responders?
Well, first responders and medical professionals are our top priorities for getting that rapid test out. We now have done over 1.3 million tests across the country, 100,000 plus tests a day. So they're becoming more and more available. But to your point, we want to know quickly, particularly if you're a frontline worker, if you've been exposed or if you have COVID-19. Abbott has a new test, and they're doing about 50,000 a day. And we're making sure that of the 18,000 units that are available to do that test, our frontline workers, our healthcare workers, and our first responders are going to get first priority to get those devices so that we can keep them safe.
But any sort of timeline as to when, for example, police officers would be able to get those? And I know you can't say it's going to be in 4 days precisely, but any sort of broad goal for when they might be able to expect those?
Well, I'd love to give you an exact timeline. What I can tell you is some are getting them already across the country. And I would say within the next month, we're working with the companies to try to ramp up production. But frontline workers, I want you to hear me. You are our top priority. We've got to take care of the people who take care of the people. And that includes our police officers, our firefighters, our healthcare workers.
Now, other countries like Germany are exploring the use of immunity certificates that would state that a person has tested positive and recovered from the virus. Is that something that is being considered here as well?
Well, everything is on the table for the task force. And as you allude to, the most important aspect to implementing a plan like that is going to be having wide availability of antibody testing. And so there are places that are doing antibody testing. We're trying to make it more convenient so that we can get antibody testing available for folks. And as we think through reopening the economy, reopening communities, and weeks to months from now, we definitely have that on the table as an option. But we can't get there until we get through these next 30 days. And the most important thing for these next 30 days is to avoid large gatherings, to avoid non-essential travel, and to make sure people are staying at home, working from home, doing school from home, doing everything they can to limit the chances that they will get or spread coronavirus. And then we can start to transition using wider availability of testing, case contact tracing, and isolation of contacts to make sure people can be safe in communities when they go out.
Now, police officers are obviously part of the first responder community, but the discussion about, PPE supply is mostly focused on getting this equipment to hospitals and to EMTs. What's being done on the federal level to get the men and women in law enforcement the gear that they need to do their jobs?
I'm glad you asked that question. The White House has had constant conversations and meetings with the police chiefs, with the sheriffs, with correctional facilities. We're always in contact with our law enforcement partners, making sure we keep them safe. President Trump and Vice President Pence I have traveled with them. There's nowhere I've gone with them even before COVID when we didn't meet with law enforcement officers, because we want to take care of the folks who are out there keeping us safe. And we're constantly figuring out what they need, how we can get it to them. I will tell you, we need to take care of our healthcare workers who we know are being exposed to COVID first, but our first responders are right up there along with our healthcare workers, because we know in many cases they encounter the people who may have COVID before the first responders get there. But to my frontline workers, my law enforcement officers, one more thing I would say is if you have someone who you suspect has COVID, please call a EMT, a professional who has personal protective equipment. We don't want you unnecessarily exposing yourself. We need you out there. We need you to be safe. So I want people to know this isn't forever. This is going to be finite, but how long it takes and how many people die in the process is going to be as much determined by what happens at the community level as what we do at the federal or at the state levels. And our law enforcement officers need to be the ones out there helping communities understand you have a role to play. Please stay at home. Please do it to keep you safe and your community safe.
What advice are you giving specifically to law enforcement? They have to work in confined spaces. They have to approach people. They have no idea who they are. They have to arrest people and get close to people. They don't know what that person has or doesn't have. What advice or assurances can you give them?
Well, one assurance I can give you is if you look on CDC's website, and there is specific information for law enforcement officers there, if you just simply do an internet search for CDC and law enforcement, the first hit that pops up is CDC's recommendations for law enforcement officers during COVID-19. What I would say is what they say on that page. And law enforcement officers in their day-to-day operations are at low risk for catching COVID-19. They're at low risk. That doesn't mean no risk, but we want you to know what you can do to make your low risk even lower, and that's maintaining 6 feet whenever you can. If you do get close, try to avoid that direct line of fire if someone's speaking or coughing. Make sure you're washing your hands frequently between any encounter with someone else, because you don't want to then touch surface and touch your face. And above all, just really understand the importance of following those 30-day guidelines, not just for the community, but particularly for people who are in the law enforcement community. Telework if you can. We know that that's hard to do when you're a frontline worker, but some people within the office can telework. And the fewer people that are in the office, the lower the chance that you're going to be exposed to coronavirus.
Dr. Jerome Adams, Surgeon General of the United States, thank you so much for taking the time to come on the program. We appreciate it.
Thank you, Dan. Hello to my people in Indiana, and go to coronavirus.gov for more tips for the community and for law enforcement. We will get through this. There is a light at the end of the tunnel if we all do our part.
Thank you, Doctor.